On arrival to the scene, check for the safety, confirm that no vehicle, no mob, no people around. If possible, ask if you have any additional people. You can ask this from bystanders. Then make sure the area is safe. You can even tell people to up to where they will stop. From there, considering this guy was hit, the suspect is spine injury, so it's good to perform inline spine immobilization. You can instruct your assistant. From there, perform general impression, and then you go ahead and check for the response. Check for response. You want to know the response of a patient. So a patient in this case is responding when you tap. Therefore, you need to inspect the airway, you assess for any circulation. Also check for the rise and fall of the chest. Inspect for any obvious bleeding, and then check for pulse as a way of checking the circulation. Also check the skin condition and skin color at this level. Remember, this one will give you an indicator if your patient is deteriorating. From there, perform head-to-toe assessment. Check for any bleeding, any laceration, any injury to the face. Check if the mandible is intact, trachea is intact. Check for jugular extension. Check for spine if the spine is intact. Check if the shoulder and clavicle are intact. Check the sternum if it is intact. Check the continuity of the ribs if they are intact. Then you'd like to assess for any pain or tenderness from the abdominal region. Note, when you are assessing, look at the face of the patient so that you can notice. Check if the pelvic is intact by opening and closing the book. Then you check if you have any breathing or fracture on the thigh. Check if there is any injury to the patella, injury to the tibia and fibula, as well as you check if the ankle is intact. Check for the motor and sensory. All this time around, make sure you are checking the face of a patient and also inspecting your hands so that you can observe for any bleeding or hidden injuries. Check for the pulse as well on lower extremity. Do the same on upper extremity by checking if you have any decapitalis on the upper extremity. Then check for the pulse, check for the sensor, check up refill, and also check for the motor. Do the same to both extremities, that is both upper extremities. Once you are done, this is the best time that since you have confirmed that your patient does not have any left threat, you can comfortably put the C-collar considering your mechanism of injury of the patient. And in this regard, since it's a trauma patient, you are suspecting a spine injury. So it's good you support with a C-collar. How do you size? From the trapezius muscles to the angle of the mandible, or the clavicle to the angle of mandible. Make sure you have that in line. We have different type of collars, so that one will be covering on another session. So this is the best way to put this type of collar. Put the flap first, then adjust in such a way you'll be able to align the front part of the collar. Make sure at all cost the collar is just below the chin. The collar is just below the chin, and the good thing with this one, you can do continuous assessment. At this level, prioritize your patient. In our case, patient is high priority patient, considering the mechanism of injury and that we are suspecting spine injury. So at this juncture, we would consider putting the patient on a spine board so that we can load the patient to the ambulance. So that's what we call prioritizing the patient. So as we load the patient to the ambulance, of course at this level, we need additional resources so that we can turn the patient. But since we are a two, we just perform as two. So you instruct your assistant that on a count of three, we're going to turn the patient. Once you turn the patient, assess the continuity of the spine. Assess the continuity of the spine. Check any bleeding from back. Check if there is any incontinence or those things. then adjust the spine. And since we are a tool, we had additional resources which during assessment then you can consider or asking for additional resources. Then there is a coordination where assistant is counting so that we have a uniform movement. At this juncture, we consider securing the patient and then we roll to the ambulance. For the sake of this video, we are not going to secure, but we verbalize and we say this is how we consider securing the patient and rolled in the ambulance. At this juncture, we are in the ambulance, so we are going to do vitals first. We'd like to note the hemodynamic change of a patient. So we are going to take all set of the vitals. This includes temperature, RBS, respiratory rate, the capillary fills, check the skin condition. All those vitals you take into consideration. Remember, these vitals give you a good examination and you are able to notice what is happening to your patient. Always take these vitals. Take these vitals. Take these vitals. I have insisted these vitals are very important. For instance, let's say you had noticed that your patient has lost a lot of blood during your assessment. You did something on the ground. Now this is the time to confirm whether you have any improvement. So these vitals, they indicate what is happening to your patient. You're able to notice that a particular vital is deteriorating. So these vitals are very important and we must take them. The first thing, once we go to the ambulance, so that we have a good record of the hemodynamic change to the patient. And then once you take them, it's good you document everything. Documentation is very, very important. So check the temperature, the SpO2, the RBS. Think of all set of vitals that you need. If possible, even you can take some blood sample for the sake of the hospital. Breathing rate is very important, and all those things. Make sure any vital you think of, it is recorded at this juncture. Very important, very important. Then from there, perform head to toe assessment, and this one is detailed. Check any fluid from the ears, check any injury, check if even people are reacting to the right. Use your pen torch. So check if the people are reacting to the right. Check if you have any fluid in the or bleeding from the nose and the mouth. Is very important. Then you check the continuity of the trachea, cora, and then because you are in the ambulance, consider exposing your patient. And then once you expose, you can perform a good assessment. Remember, in the case of the secondary assessment, which entails the detailed assessment for trauma patient, we focus on 4 main things: inspection, palpation, then when necessary you percuss, and then you auscultate. A good example is chest. Right now we are inspecting for any laceration, any contusion, we are inspecting for decapitations. From there, consider auscultation. Consider the 6 point of auscultation. Very important, so that you can detect the breathing sound, the air entry to the lungs. Then you percuss for the lung sound. You percuss for the lung sound on the 4 point. This is the main difference between the primary and secondary. This is what you should note. Then from there, consider palpating. Remember, you consider palpating the continuity of the ribs, and if you notice anything from the patient. If the patient is speaking, tell them, if you feel pain, kindly inform me. Very important, because you are engaging the patient as well. Once you are done with the chest, do the same to the abdomen. Expose, inspect for any laceration. Sometimes you can find even previous scar. It tells you something. So check for contusion, laceration, or anything that you suspect. From there, consider auscultating. In the abdomen, we say it's critical that you assess when you are auscultating, take at least 10 to 30 seconds so that you can perceive the bowel movement. Once you are done with that, you can consider now percussing. So you notice any abnormality. Remember, the normal sound when you are percussing, it should be tympanic. It's advisable you percuss or abdominal region. Then from there, consider covering because you are done. Don't forget about palpating. Palpate for any pain, any tenderness in the mass. Again, palpate all the 4 regions or the 4 quadrants, not region. Sorry for that. Or the 4 quadrants. Cover the patient, upper extremity we are done, and then so that you can consider now exposing the pelvic. You do the same, you do inspect in these regions or in these areas. You only need to inspect and palpate. Inspect and palpate. In the pelvic, remember I say it is open and crossing the book so that you can detect any injury. Expose the lower extremity, inspect for any bleeding, any contusion. You are inspecting for decapitated areas, then palpate, ensure your eyes are on the patient so that you can detect any change, Check for any fracture or bleeding. Check for the continuity of if the ankle has any challenge. Check the pulse, check the sensory and the motor as well. Do the same to the other extremity. Expose. Once you expose, it's good you inspect for any laceration, any contusion. Then once you are done with inspecting, palpate for any fracture, any bleeding, palpate if the patella is intact. Check if the tibia and fibula is intact. Very, very important. Very, very important. Then you do that also to the upper extremity. Inspect. Check for any color change, palpate if there is any decapitated. Check if the elbow is intact. Then check if you have any injury to the tibia, urinary radius. Capillary fill is very, very important at this juncture as well. Then continue, do to the same to the other extremities. Very, very important at this juncture. We know very well what we have. Now we can comfortably say we will conclude that we will reassess our patient after the 5 or 10 minutes. And then, very important, we can consider calling the receiving facility and we inform them the estimated time of arrival. Thank you very much.